what it is, how can it be cured, what kind of problem it is it going to cause them infertility, is it cancer, is it preventable, is it hereditary, and what is it actually? Can they take medication to make it shrink, or can it grow back? Sort of things that women will ask. One of the commonest reasons why women present with gynecological emergency is ovarian cyst, followed by ectopic pregnancy, followed by pain from fibroid, then followed by pregnancy, and so on and so forth. So ovarian cyst is very common in women. 4 out of every 10 women that are within their reproductive age group will have ovarian cyst. First of all, I want to give you good news. Ovarian cyst is not cancer, okay? And most especially if you are within your pre-menopause, that is to say you've not yet reached menopause, it's unlikely that a cyst on your ovary is cancer. Unlikely. So tonight, this is the topic, ovarian cyst. So first of all, when people ask question, what is the ovary? My business in the human body, and since I left medical school, is 2 things or 3 things: womb, ovary, vagina. That is what I do. Okay. So it's very, very narrow. It's a subspecialty. Ovaries, womb, and vagina. So this is the ovary. That white structure here on either side, left and right. The ovary has 2 functions: to release egg, usually every 28 days. And the other function is to produce progesterone and estrogen to make you feel like a woman. Estrogen makes the skin of a woman shine soft, supple, very fantastic, makes women look beautiful. They have that hip shapes. Women are lovely creatures. So that's the purpose of estrogen, reproductive hormone function. Okay. Now, ovarian cyst is very peculiar in the sense that it could be simple cyst or complex cyst. Another way we describe them is to say they are functional cysts or complex cysts. And when we say simple or functional, it means from the name, functional is part of the function of the ovary. Okay? It's part of the function of the ovary. Somebody will say, doctor, all this one is not my business. Let me know what I will feel if I have ovarian cyst. The commonest thing in the human body that God has given to us is pain. When there's pain, it's a sign there's something wrong. Usually people have pain in their lower abdomen. They feel heavy in their lower abdomen. Imagine a cyst, okay, like this ovary, another ovary like that, a big blob there. There'll be extra weight. You say, but it's very small now, it can cause pain. It's going to be pushing on other structures in the tummy, it can cause discomfort. That's number 1. Pain during sex, number 2. We call that dyspareunia. Pain during sex is called dyspareunia because of the ovarian cyst. Sorry, excuse me. So, during sex, as the penis is going in the vagina, sometimes it can put pressure effect on the ovary on either side. An ovarian cyst could be on one side or it could be on both sides. Okay, so pain in the tummy, that is pelvic pain or pain in lower abdomen, and pain during sex. Sometimes too, pain during the period, that can happen too, and it can even be so big it can compress on the bladder. The way the human body is, if you cut the body of a woman into 2, what we call sagittal section, you see the bladder in front and the I thought I had the structure around. So you see the bladder in front, the womb in the middle, and the bowels at the back. When you have a cyst, okay, it can compress on the bladder in front and make you pee frequently as if you're pregnant. And in some rare situation, some cysts on the ovary can make it difficult for you to get pregnant. I'll talk about those later. So when I say that 2 ways to classify cysts, we have simple cysts and which are functional cysts and complex cysts. Simple cysts, functional cysts they occur frequently on and off as part of the function of the ovary. Remember I said the two functions of ovary is to ovulate and also to produce hormones for reproductive function. Regularly every month, a small tiny particle on your ovary will form a big blob or a small blister. We call it follicle. It will pop, release an egg, and the egg will move into your tube and travel all the way down into your tube to your womb cavity. While it's wandering about there, the sperm are already flowing and looking for where's the egg. By their angry nature or their GPS system, they're looking for where's the egg, where's the egg. They jam the egg, bam, they cause pregnancy. So remember I said the egg will be released from the ovary. At that point where that egg is released, that area on the ovary must get shrunken back. In some cases, as it's trying to close up back, it can be filled with water, what we call follicular cyst. So remember I said it's a follicle, it releases an egg. So that area on that ovary, just imagine the surface of the moon. If you're very good with geography, moon, science, okay? That surface on the moon, you see some tiny holes on it. So as soon as that ovary is being released from that surface of the as soon as that follicle releases egg, that area on the ovary that releases that follicle must close back and heal and start another cycle again to release another egg next month. That area can be filled with fluid and cause a follicular cyst. Most cases it will disappear after about 2 or 3 months. That is a simple cyst. When you do a scan and you see a cyst like that and it's black inside, it's full of water, like a blister, it's a simple cyst. Don't even bother. It doesn't cause infertility. It doesn't cause damage to the ovary. It's part of the ovarian function, part of the way the ovary function. That's why it's called functional cyst. Functional cyst. Functional simple ovarian cyst or simple ovarian cyst. Nothing to do. In most cases, you scan you back again in 2 to 3 months down the line, it's gone. Another number 2 type of simple cyst or functional cyst is that same type of follicular cyst on the ovary. Instead of it being filled with fluid that will disappear, it can be full of blood. What we call hemorrhagic cyst. Hemorrhagic cyst. Hemorrhagic ovarian cyst. It's a simple cyst as well. It will disappear on its own after a while. Another type of simple cyst again is luteal cyst, or we call it corpus luteal cyst. That one is so special. At every normal pregnancy, okay, once you ovulate from ovary and the egg is swimming down the tube into the womb, there's always a particular leftover. Like I said again, that area that the egg got released from the spot on the ovary is called corpus luteum. That cyst itself produces progesterone, which ensures that the pregnancy, that egg, is surviving. That corpus luteum cyst produces progesterone and continues to do that for at least 12 weeks until the pregnancy implants, the baby is forming, and the placenta is fully functional. Up to 12 weeks. And then that corpus luteal cyst will start to shrink. Corpus luteal cyst. CORPUS LUTEAL cyst, CYST. If anybody goes to remove that cyst in early pregnancy, that pregnancy will miscarry. The cyst is essential. It supports the pregnancy until 12 weeks. It must not be touched. And you see it is when you scan, you see blood flow around that cyst on that ovary. It means that that person ovulated from that side, left or right, wherever you see it. And it must be left intact, not touched. You say, you have a cyst on your ovary at 6 weeks, go and remove it, don't touch it. It's probably corpus luteal cyst. If you touch it, the pregnancy will miscarry. It must produce progesterone until that person gets to 12 weeks, then it will start to shrink. Another number 4 cyst we have. Okay, now let's leave that one. So we finished simple cyst now. Complex cyst can be either normal or abnormal. And when I say normal or abnormal, I mean that complex cyst can become cancer, abnormal, or it can go away, normal. If you see a cyst called dermoid cyst, DERMOID, Delta Echo Romeo Mama Orange India Delta, dermoid cyst. That cyst is so special in that it contains anything. It can contain wax from your ears, can contain teeth or bones, anything inside it. It's a complex cyst. Because the ovary itself has power. The ovary is like a nuclear reactor. It can produce anything. The ovary can have cells that can become muscle, high, bone, and so those cysts can take some cells that they become abnormal and they start producing abnormal things around them. But they are not cancer. You open them, you can find bone tissue, cartilage, wax, anything inside, skin, even skin inside. It's a dermoid cyst. It's not cancer. Dermoid cyst can happen on the ovary, but it's complex because it contains different things. It's not the simple cyst that contains water or blood. Some people will still call hemorrhagic cyst complex cyst anyway, but in most cases we still call hemorrhagic cyst simple cyst because it goes away. Another complex cyst that is not cancer is endometriotic cyst. Endometriosis. Endometriotic cyst. What does that mean? Endometriosis is basically all this part. You see your womb, eh? I've cut the womb open. A brown part here, a red part, and a pink part that resembles my lips like that. That pink part is the inside of the womb that bleeds every month, that recycles every month. For some reason we don't understand. That pink part, some of the cells will find their way out and move into the tubes and go and implant on the tube outside here or on the ovary. You can see them, those black spots behind there. They are endometriosis. You can even see them on the tube here or on the ovary. They are endometriotic cysts. So endometriosis is when this skin that inside the womb that normally bleeds out, they find their way and go and implant outside. But because they can't bleed out like their cousins and brothers in the womb, they will stretch every month containing blood and they will shrink back. So some people, they always have pain few days before their period comes. As soon as the period comes, the pain will go away. It's probably have endometriosis. They're having sex with their husband, they're having pain at the back, close to their bowels, inside there. It's probably the man is hitting the endometriosis. But the funny thing about endometriosis is that endometriosis cannot be seen on scan. They are too small. But if they implant on the ovary, they can cause a cyst that we call endometriotic cyst. And the abnormality about the endometriotic cyst is that every month when they bleed inside of them, when those cysts bleed inside, they get bigger and bigger. So the pain you're having during your cycle, during your period, it gets worse as each period comes. Because it's getting bigger and accumulating blood. After every period, it will shrink back a bit, but not completely back. Your next period comes again, it gets bigger. By the time you're after about 3-4 years down the line, the cyst is so big as a big egg ball size, as orange. It's full of dark old blood. And we open it during surgery, it will spill out thick blood, very smelly. It's whole blood. Like when you open this eclairs chocolate sweet, Cadbury sweet, that you see a thick chocolate paste inside. In fact, we call that cyst endometriotic chocolate cyst. If you see it in theater, it's like a pure chocolate The blood is dark, like chocolate. We call it chocolate cyst. It's the same thing as endometriotic cyst. It can cause pain. It can cause that one can cause infertility. That is endometriotic cyst. It's not cancer. It's just endometriotic on the ovary. Endometriotic cyst. Other cysts too that can cause cancers, and they're also under complex cysts. Those are obviously ovarian cancer, and there are so many of them. Dysgeminoma, so on and so forth. That one is a big another area entirely, but it's very, very rare for a young lady under 45 to have cyst on the ovary as cancer. Cancer on the ovary is usually very commonly found when people are over the age of 60 and above. If somebody that's never had cyst all their life, suddenly they find a cyst in them at age 60 and they have so much water in their tummy, my sister, is cancer, until proven otherwise. A woman that's never had a cyst all her life, suddenly they can scan her, they see a cyst on one ovary and there's so much fluid in her tummy, what we call ascites, is cancer until proven otherwise. You ask me, so how do you diagnose a cyst? Ultrasound scan. Simple ultrasound scan, transvaginal ultrasound scan, that is a scan from the vagina, is a long scan probe, like a stick in the vagina. Doctor, they put one stick in my vagina, is transvaginal scan. Because it's much closer to the womb, we'll see a lot well. We'll see the ovaries well, both sides, and the womb itself. We can also scan you from the tummy, especially if you are not of the obese type. It's easier to scan your skin on your tummy to see too. But if we are worried and want to see very detailed structures, we scan from down below, transvaginal scan. The one on your tummy is transabdominal scan to see clearly as well, usually for people that are not too obese. So that is way to diagnose ovarian cyst. Now, not all cysts will be obvious on scan. In some rare situations, we might even do a CT scan. Yes, if we think that there are other things that maybe we are suspecting cancer, we want to see the extent of the damage. But like I said again, for young people of our age, by the grace of God, it's very, very unusual to find cancer of the ovary. That is why if you have a strong family history of cancer of the ovary, okay, you are likely to consider removing your ovary. If you have a persistent cyst and you're getting age 45 and above, just remove those ovaries. They can cause more harm than good. If you have a very strong family history of breast cancer, you're a lady, your auntie has breast cancer, your other auntie has ovarian cancer, once you finish having your babies, just go and remove those two things. You don't need them anymore. You can even remove your womb too if you want, and keep your vagina and keep having lovely sex with your husband and live a long life. It's something to think about. Now, somebody will say, okay, doctor, what kind of blood test can I do? Yes, there's some blood tests too we can do too if we suspect cancer of if we suspect ovarian cyst, or we are thinking maybe there could be some element of possible cancer. Remember, I said that cancer of the ovary is very rare in the young age group, but it's still possible. We have some rare cancers that can affect people that are young. If somebody comes to me, somebody of any age anyway, and I can see a cyst that is so complex and suspicious, after doing the scan, ultrasound scan, we still do some blood tests called CA125. Don't worry about it. It just means CA125. Charlie Alpha 125. That blood test will give us values to suggest that if this value is too high, usually the normal value is between 0 and 35. If it's more than 35, or usually if it's above 200, wahala. If it's more than 35, we tend to pick and monitor with close eye. If it's more than 200, it's likely to be something cancerous or dangerous. Now, not all cysts are cancers, like I said. If I see a cyst in a young lady, 34, 35, 25, okay, and the cyst is a simple cyst, about 4 centimeters, I'm not going to rush them to theater. No. Because in most cases, it will go away on its own within 3 to 4 months. So as far as it's not causing the girl pain, I leave it alone. I scan her back in 3 months' time, it's gone. That's fine. But if somebody comes to me, a lady, 25 years old, has a cyst on the ovary, 5 centimeters, she's in serious pain, it's likely that the cyst is twisting, what we call torsion. As it's twisting, it will be cutting off his blood supply and it will be causing pain. And the person will be in serious one-sided pain, what we call severe unilateral pain. For such people, it might be ideal to scan them, watch them, or go to theater to go and untwist the ovary. Yes. What we call ovarian detorsion. Okay? So you wonder, why do we have to watch a theater for a young girl? A young girl, 25 years old, who has never had a baby before, her ovaries is torting and twisting on itself. The blood is cutting off his blood supply. It can destroy the ovary and damage the ovary, and the girl might not be able to get pregnant again. I don't want to be the cause of the person being infertile. So I want to go to theater and untwist the ovary and stitch the ovary to the wall or to what we call the pelvic side wall to keep it fixed and prevent another torsion. As far as we untwist the ovary on time, the blood flow will reestablish again, and most ovaries, almost 90%, can be saved. No matter how bad the ovary looks in theater, if you untwist it, leave it alone, the ovary is so powerful because it regenerates itself. The ovary takes blood supply directly from the abdominal aorta, so it quickly restructures itself back quickly. It quickly gets back to normal. So ovaries can be salvaged as far as we untwist them and we fix them to the pelvic side wall. Okay? And how do we do these things? 2 ways. We can open you up with a small stitch on your lower abdomen across, what we call laparotomy, to open up, laparotomy. Or we can go in through keyhole surgery if that is available in your center. It's not very common in Nigeria. We make a small tiny cut on the umbilicus and we put the camera there and we can work with that keyhole. That will make the person recover quickly, but the tools must be available with the expertise to do such a thing in theater as soon as possible. It takes time to do, but it's doable. Now, if someone has ovarian cysts, if we open them up to remove the cyst, we simply take out the cyst only, whether it's on the left or right. We don't take the ovary away. We just take the cyst away. Okay? In very, very rare situation, if we think that the ovary is damaged, very rarely we take out the whole ovary, but it's unlikely. We just take out the cyst alone and it will heal itself. Okay? Am I making sense? Do you have any questions so far?
Yes, sir.
What questions?
What happens if it's not?
Ovarian cyst, right? Yeah, like I said again, if it's not causing pain and it's a simple cyst, most ovarian cysts will disappear within 3 to 4 months. But if it's causing pain, we'll probably drain it. The funny thing is that there's no way you can give any medications to prevent ovarian cysts. Sometimes some people, there's a study that says that if you give combined contraceptive pills consistently, sometimes we prevent ovarian cysts. But to be honest with you, it's not a consistent research. So there's no way you can prevent it. And if there's a cyst on the ovary, there's no medication you can give to go and shrink it. Okay? If you shrink an ovarian cyst, the chances that you probably give medications that will switch off the ovarian function itself, and that'll make the person go into a kind of a temporary menopausal phase. The person will be moody, sweaty, which is not necessary, to be honest, because most cysts will disappear on their own as far as it's not painful. If it's causing pain, we open it up, take it out, suck it out, or resect it away. Did I answer that question?
Yes.
Some people ask, okay, doctor, what? So,
Is it a disease that you contracted?
okay, very good. Well, it's a disease, but it's not an infectious disease. It's not hereditary. No. But we know that endometriosis can run in families. Endometriosis is on its own. It can cause, like I said at the beginning, it can cause endometriotic cysts. Those ones can be common. If in a family, the sister, the mother, the auntie have endometriosis, it can run in family and they can have endometriosis. which can further lead to endometriotic cyst. But ovarian cyst itself, as a something, is not hereditary, is not infectious, is not contractable among girls living in the same place, and no medication induces it or make it happen. And there's nothing, one thing that causes it. No. It's a what we call multifactorial thing. But it goes away on its own. So there's nothing you've done or you've undone that has made it happen to you. Okay?
Someone said, has it causing her pain?
Yes. If it's causing you pain, intermittent pain, it's possible that it's an endometriotic cyst. But if our advice, I'll say get a scan first of all to see how big it is. And if it's a simple cyst, if it's a simple cyst, just get scanned again in about 3 to 4 months' time, it's gone. But if it's still persistent, you might want to consider taking it out. Can we continue? Or do we have any further questions so far? Okay, very good. There's another thing we call the polycystic ovarian syndrome. Okay, that one causes confusion for a lot of people. Remember, I was showing you the ovary like this. This is an ovary cut open. Ovarian is a cyst outside the ovary. It can twist on itself and cause pain, what I call ovarian torsion. But it can untwist back and so on and so forth. But PCOS, polycystic ovarian syndrome, is tiny cyst within the ovary, within inside. Ovarian cyst is without, outside. Ovarian cyst is ex-ovarian. PCOS is intra-ovarian, inside. Polycystic ovarian syndrome, PCOS or PCOS, is tiny cyst within the ovary. It doesn't cause pain. Okay, that one is notorious to cause infertility. Okay, PCOS, polycystic ovarian syndrome, is many cysts within the ovary. It doesn't cause pain. In most cases, it's harmless, but it can cause hormonal imbalance too. Okay, so one of the I've got a question from Jack. She's saying, I think she's saying that her cyst is 2.7 centimeter. That's a bit small. It's unlikely that cyst is causing you pain. From my experience, so it's unlikely it's causing you pain. And in fact, by the time we go there, by the time we get there, we'll probably rupture it on its way in. And it's gone, we won't find it again. So it's not good to put you under anesthesia, so much risks, just to look for a 2 centimeter tiny cyst on your ovary. What I'll do is to monitor you, give you painkillers, and rescan you in 2 to 3 months' time. Ideally, 3 to 4 months' time. But to make it easier for you, I'll do it 2 to 3 months' time. Okay. So, I said again, watchful and waiting. We scan you, we check you, we keep keeping your CA125 hormone profile to ensure that you're not having something suspicious or something cancerous in your ovary. So we keep an eye on the ovary. Surgery, like I said again, to open straight away up or keyhole surgery. Okay. I think I'm coming to the end of the discussion, and I will take questions if it's possible.
So before we were waiting questions, but before that, like, what advice can you give to our listeners about screening for prevention or and seeking early treatment?
To screen for ovarian cyst, once you notice pain, whether doing sex or during your period that is not settling down, it's suggested for you to go and get a scan to screen for ovarian cyst. In most cases, a transvaginal scan is much reliable to screen for ovarian cyst. And also, test we can do is to do blood test called CA125. Usually, it's supposed to be within 0 to 35. If it's with less than 35, it's okay. And we can also repeat those blood tests in 3 months down the line again to screen for it. To prevent ovarian cysts, one of the ways is to take contraceptives, which some people will not like if they want to get pregnant. But in most cases, as soon as you get pregnant, the ovaries will stop functioning because you're already pregnant and cysts are gone. Because your body has got other things to focus on to develop the baby. Treatment-wise, there's nothing that can shrink ovarian cyst. It's either it's there, it disappears, or it gets bigger and it reveals itself, and then we deal with it. Did I answer that question?
Yes, you did.
No, it's not convincing. The way you squeeze your nose is not convincing that I answered that question.
Another one is it says I'm trying to let it sink in like this.
Okay.
Another one is this in this is our age of restricted access. Many of us, don't let me exclude myself, many of us are turned to traditional and alternative medicine. Some people ovarian cyst, they will know that this is ovarian cyst, but they will tell you Alalade will come after me, Alalade will come and all that, you do that. So what is your opinion regarding this?
Okay. I've come across a discussion from a lady about 3 or 4 years ago who had ovarian cyst, and she said she was going to take something called molasses or something like that. Some sort of drink that helps to shrink a cyst. Now, I, as a doctor, I have no objection to herbal treatment or anything, but I can never recommend it. Not because I'm a doctor and I don't want them to patronize me, but because I don't understand it. Because I don't understand the language doesn't mean that language is bad. I'll just not speak it. So this herbal stuff, some of them work. After all, we've been treating malaria before they brought us quinine from abroad. We're treating malaria now, and we are alive. Otherwise, we'll all be dead now. So everything in this world, any problem in this world, everything we are using in this world, whatever you call it, is either from the ground or from the thin air. Everything is either from the ground or from the thin air. Whether what we eat, what we sleep on, what we ride, what we move on, what we sit on, everything is somewhere from the ground or from the thin air. It's not from space. So there's some point where our eyeball stuff will work, but I don't know how to apportion it, how to work on. I don't know it. I've not trained. I wasn't trained on that. So there's no way I will speak a language I don't know. So I would suggest, because I don't understand it, I cannot advise on it. But I'm sure if they do research on those herbal stuff, they will find a way of sequencing the right substances that are useful. Because you don't say because because you're a Christian, people that are Muslim are bad, or because you're a Christian, people that are Buddhist are bad. No. That's not my business. I want to learn from them what I can use to improve my life. So if I was a health minister, I'll bring everybody together. Let us work on this and sequence what is useful, what can be used. It will be a research thing, but it's not. It can't be done in a point because everybody's afraid of herbal thing. You're afraid of this, but look, there's a way we can work together. But me, I don't understand it, so I cannot recommend it. However, if you know what you can use to treat ovarian cyst, I won't say don't do it. But if at some point, you are scanning yourself and the cyst is not getting better, go and operate it. Keep yourself alive so that you can keep trying other things. That's where I come in.
So somebody said that taking cysts out advisable, and can it prevent pregnancy? That taking it out, will it not prevent getting pregnant? Like after taking, you said prevent pregnancy, children.
Okay, I think what he's trying to say is that if we take out a cyst, will it cause damage to the tubes that can prevent pregnancy in future? Or will it cause some sort of a complication that can cause infertility in future? It's unlikely. It's unlikely. Except that cyst has damaged most of the ovary, or except during removal of the cyst, there's so much bleeding from the ovary that it becomes necessary to remove the ovary to save that person's life, which is unlikely in a properly skilled surgery, except you go and damage or touch the ovarian artery. The ovarian artery bleeds like anything. Yes, it's a direct branch from the abdominal aorta, and it feeds the ovary or in the man the testicles with so much blood supply. The blood supply to the ovary or to the testicles is high flow. It's like a direct branch from the direct source or from the nature's waterworks. Any damage to it to bleed like flood, as small as it is. Because the ovary is so powerful, the testicles is so powerful, they must keep producing gametes to get human race to continue. So if there is damage to the artery during surgery, it can necessitate removal of the ovary. But it's very, very unusual. Unusual. Very unusual.
Someone said, is there a possible recurrence?
It's possible. Ovarian cysts are known to recur. Yes. Yeah, they're known to recur. Question will be, how can you prevent it from happening again? Unfortunately, medical science has not yet been able to arrive yet how to prevent cysts from recurring. But people that have had cysts before can recur again. In fact, if you had a cyst, the number one risk of having a cyst is being a woman. Number two reason to have a cyst is if you had a cyst before. There's Mrs. Sotika is saying that there's a question for me somewhere.
She said, I've already asked the question.
Oh, I got you. Someone is saying that.
Sorry, is it hereditary? You said it's not hereditary, right?
No, but endometriosis has proven to be associated in families. Now, they haven't sequenced the gene. I think it's that there's, anyway, they haven't sequenced the gene, but it's in the family. So if endometriosis causes endometriotic cyst, so indirectly, that endometriotic cyst will be familiar too. But ovarian cyst, as a subset on its own, is not hereditary. But endometriosis itself is hereditary. It can be hereditary, and if it forms endometriotic cyst, that can become indirectly hereditary too. Someone is saying that after removing a cyst, how long will it take to get pregnant? And is there a risk of recurrence? The second part is the first one. There's a risk of recurrence. As soon as you remove the cyst, within 4 to 6 weeks, you can start trying to get pregnant again. Especially if you had a keyhole surgery, what we call laparoscopy, that keyhole surgery. If you had that one, usually within 4 6 weeks, you can start trying to get pregnant again. Because we haven't touched your womb at all. It's just simple surgery. So once you're sexually active, you start having your period, after a surgery like that, you can start trying for baby. Okay?
Okay. So someone says, thanks for the message, Doc. You said if you have never had a cyst before, but your belly is big, means filled with fluid, might be ovarian cancer, or if proven otherwise. So she said, come in. She said, also, is there a chance of otherwise? So ask if sorry. Okay. Said ask if you have a baby. Okay. Okay. She said, let me start from the beginning right now. Said you said I had a big, means it's filled with fluid and might be ovarian cancer or if proven
Otherwise.
So she wants to ask if you yes, she wants to ask if you have a stomach, okay, section. If you have a baby and it's a section, I mean CS section, and your stomach is still very big after 6 months, is it ideal or it should be a cause for alarm of having an ovarian cancer?
First of all, half knowledge is dangerous. Though. That's not what I said. I said if I see a woman above 60, Yeah. You see, in science, in medicine, everything is, in life, everything is time bound. If I see a baby crying, I won't worry. But if I see an old woman crying, I'll worry. Oh. So I said there, if I see a woman 60 years old, for example, above 50, that has gone through menopause, and she's never had a cyst, all of a sudden, she has a cyst that develops so fast, or develops a cyst, and there's too much fluid in her tummy, is likely to be cancer on the proven otherwise. So that age changes everything. Time factor changes everything. So that age factor is very, very important though. Now, so that one of CS, big tummy, is not going to play here at all. I don't think a woman of 60 years will have a C-section, except she had IVF. That one is a peculiar situation and it's totally out of this discussion. Okay. What I'm saying is a big tummy full of fluid. The tummy, a tummy that is big post C-section is not full of fluid. It's full of baby fat. But if I scan a woman 60 years old, 55 years old, 70 years old, got a big massive cyst as big as my head with so much fluid in the tummy, water. It's not hair, not gas, fluid, water. I know hair too is fluid though. I mean liquid, liquid, not fluid gas in the tummy. It's likely to be cancer. So it's not post C-section with baby fat that there's no water inside the tummy. This is massive water, about 5 liters of water. There's wahala.
So I want to ask you, it seems you've mentioned it, but I just want to try and retrieve it back. How common are they in Nigeria?
Ovarian cyst?
Out of 10, 4, yeah.
Very common. Out of every 10 women between the age 18 to 45, you're going to have 4 that will have a cyst. Yeah. And 3 of them will not be in pain. Only 1 will be in pain. Because it goes away quickly and they don't even know. So do I start puncturing everybody's tummy? No. But the thing is that once a woman sees a cyst on scan, she thinks that's the problem causing her infertility. That while I don't start, hey, surgery, don't panic at all. Because the doctor will feel as if he or she doesn't do anything for you because of your cyst, you probably go and meet someone else. She want to do something and think you want to do something and make you feel as if she's doing something or he's doing something. So they want to engage you. Take this, take that, take that. So you won't go away with that. We didn't go away because if you go away to somebody else, you carry their money away. So they want to see as if they are doing something. We call it masterly inactivity. Masterly inactivity. You are doing nothing. We're just watching. It's masterly inactivity. So don't panic. Just get a scan.
There's a question
Yeah.
but I think I should be able to answer that. I've learned something. So can one get pregnant with I guess that one should be depends on the kind of
Exactly. Now you're becoming a doctor. Thank you very much. God bless you. And I give you MBBS half, University of Alalade.
I'm honored. So, okay, someone is saying, I think that one would have to get to you through, I guess, through Christina. So can I book a section with you?
Yeah, Christina. I forgot something else. There's another thing we call Meigs syndrome. Yes. Meigs. Meigs syndrome. That one too can cause a lot of fluid in the tummy of a young girl that is not postmenopausal. Yeah, I forgot that. Meigs syndrome is also another cyst of the ovary, but it's benign, it's not cancer. But it's common in people that are not yet menopausal. They are about 30, 40, 50. A small cyst on the ovary, but there's so much fluid in the tummy, even in their chest. That's Meigs syndrome. In fact, we drain the fluid, it will reaccumulate again. And you think it's cancer, like the one you see in the above 60s that contains water. But when we tap the fluid and we go and check it under microscope, there's no cancer cells there. That's Meigs syndrome. In most cases, we remove that ovary that is damaged. and the thing will go away. But we have to drain the fluid from the chest and from the tummy. It's very, very rare. Very, very rare. But it's peculiarly found if you are premenopausal, before menopause. Meigs syndrome. Meigs. I forgot that. It's a complex cyst as well.
People are now asking a lot of questions and we don't have much time again. Let me see if we can take one more.
Exclusive to 360.
There's a lady called Mark. She's saying, does a functional cyst cause pain? No, it doesn't cause pain. Thank you. See, it makes sense already. It's functional cyst. It doesn't cause pain. No. So it doesn't cause pain.
Can I always put doctor at the beginning of my name now, because I think I'm loaded right now. I'm loaded, but if I'm going to put the doctor, I'll put doctor in ovarian cyst
Only. So you call it subspecialty, subspecialty, ovarian cyst only. Special interest, ovarian cyst.
Yeah, my specialty. Yeah.
Special interest.
Thank you so much, Doc. I enjoyed myself.
You're welcome.
Because you use simple words. I was thinking you are going to use all these medical terms and I'll probably be like,
Nah.
but you did justice to it using our terms. You came down. Let me use you came down to our level. Like well level.
Thank you.
Yeah.
You're welcome.
Let me use the white shake go and do penny.
Thank you. I feel honored. Thank you.
I hope we can. Let me be positive. I know that when next we call you, you will say yes to us.
By the grace of God, God willing.
Yeah. So on behalf of myself and everybody, not only Urala Foundation, and everybody, we say thank you. We say we love you.
Thank you so much.
Okay, Saya just seen this. Someone is asking. Okay, can't take any question again. So in case anyone has questions or anything, we'll get just DM us. Definitely, we'll get through to everybody by
Yeah.
Right. So thank you so much, Doc. Really appreciate it.
Thank you, guys. I really appreciate you.
Thank you.
God bless your work.
For pouring to us, for dishing it out to us with so much appreciation. We love you so much. Thank you. Thank you so much.
Thank you.
Have a wonderful night.
Yeah.
Bye.
All right.